Thank you, Jennifer, and good morning. Here's what the numbers say this morning. We have 95 reported cases of COVID-19 in the province. 44 are here in our city. There are 2 people being treated in hospital here. 1 is in intensive care. 1 person in our city is listed as recovered from COVID-19. Province-wide, 4 people under the age of 19 have now tested positive. 57% of all cases are male. 43% are female. So far, 6,915 tests have been conducted. The number of officially recorded coronavirus cases around the world has now pushed past 500,000. More than 180 countries have been affected by this pandemic. Nearly 23,000 people globally have now died. As Canadians adjust to the new reality of social distancing, many are concerned over the risks of everyday activities. That includes potential exposure to the virus from trips to the grocery store.
You don't need to disinfect your cans, jars, and other packages from the grocery store. Siyun Wang, an associate professor of food safety engineering at UBC, says that is not how people get infected with COVID-19.
There is very low risk for it to be transmitted through the containers.
Coronavirus is spread through respiratory droplets. It can live on some surfaces for up to 3 days, but it can't grow or multiply in a fridge, freezer, or cupboard. Health officials say there are no reports of the virus spreading by touching food packaging. The BC Centre for Disease Control says cooking kills COVID-19 and other microbes, so people ought to rinse their fruits and vegetables under cool water as usual. Wang says the biggest risk is at the grocery store. Wang says washing your hands is the most important thing you can do when you come home and before cooking a meal. Andrea Ross, CBC News, Vancouver.
The health authority has suspended some screening and isolation for 2 superbugs. One expert, though, says it's not a sign the system is overwhelmed. Earlier this week, the Saskatchewan Health Authority issued a memo to staff. It explained that except for high-risk patients, screening and isolation for MRSA and VRE are on hold. Dr. Raywat Deonandan is a global health epidemiologist at the University of Ottawa. He says this move is likely intended to free up resources.
The overwhelmingness comes when the number of available ICU beds is exceeded. So the idea is to keep the number of new cases as low as possible, such that that percentage that requires serious hospitalization is beneath the capacity of your hospital system to give care.
Deonandan says he does have concerns about superbug outbreaks in the future, but for now, the focus needs to be on COVID-19. Items such as respirator masks are disappearing in our hospitals. Workers at one of the province's healthcare unions got a memo this week saying the health authority is investigating missing supplies. Barbara Cape is president of the SEIU West. She says her members need those items.
But I guess on the other hand, you also have to consider if those supplies go missing, it is also my members who are without supplies who need them the most.
The memo did not say where the thefts occurred. It says the thefts could cost lives in the future phases of COVID-19. Coming up on 7:34, it's sunny, -6. This is Saskatoon Morning. Traffic right now is okay. Later, there's new work set for Spadina from 2nd to 3rd and 20th at Avenue S. Here's our traffic report number. It's 306-956-7444. Other news we are following, there's an impasse over mediator recommendations in the dispute between the co-op refinery in Regina and the union, Unifor. Workers were locked out in early December, 2 days after issuing a strike notice. The refinery has modified some of what the mediator wants and has given a final offer. Scott Doherty is the executive assistant to the president of Unifor. He says the refinery should stick to the report.
Our members are not thrilled with the deal by any stretch of the imagination, but obviously we want this dispute to end, and we were prepared to live with the mediator's report.
Doherty says Scott Moe should put the mediator's recommendations into law. The province says it will not step in at this time. Instead, it says both sides should get together and talk. Returning to our top story, people are being asked to think twice about recycling if they're sick. Loris Recycling would prefer you trash items if anyone in your house is not feeling well. The company's Alexa Mafazali says this is an effort to protect employees during the pandemic.
This is not just sorted by machines. There are real people who sort this material. Please keep their safety and their lives and their families in mind when you're putting stuff into your cart.
People are also asked to put their recycling carts in the correct spot to limit contact between drivers and the public. Veterinarians are considered essential services during the COVID-19 pandemic, and vets need to make sure they're staying safe and not getting sick. Kent Weir is the president of the Saskatchewan Veterinary Medical Association. He says one way they're protecting themselves is by limiting the types of procedures they do that require protective gear.
The PPE, the personal protective equipment, so masks, gloves, those things are really in short supply right now, nationwide and globally even. So if we can try and preserve what we're using for PPE, we're trying to eliminate some of those procedures.
Weir also says vets are practicing curbside medicine. They'll chat with owners on the phone, then go outside to get the pet from the owner's car. Netflix is lowering video quality for subscribers in Canada. The company says it's intended to reduce soaring demands on the internet bandwidth during this pandemic. Telecom companies have seen a sharp rise in data usage as Canadians self-isolate at home and use streaming services more frequently than usual. Netflix has already done this in a number of parts of the world, including in Europe and Australia. That's it. That's all I've got.